Hi, this is Jackie from Greenleaf Consultancy, Therapy and Wellness. In a previous video, we talked about checking in on your breathing and how it's helpful to understand what your breathing pattern is like. If you haven't seen that video, go back into my Instagram or onto my webpage and find that, because I think that's a helpful starting point. What I want to do today is talk about a breathing technique that's quite helpful if you're feeling a little bit anxious, or if your breathing is a little bit fast, you're feeling maybe a little bit breathless. It might be that your breathing pattern is a little bit high in your chest and is involving your shoulders. So if the first thing to try and do is really try to relax your shoulders and settle the breathing, and maybe try and breathe more from down here. So again, place your hands as they were before when you were checking in on your breathing. Relax those shoulders and just see if you can breathe a little bit more from this lower hand and less from up here. It does take a bit of getting used to, takes a little bit of practice. And don't worry if you don't get it to start with, because practice makes perfect, and you keep trying, because it will make you feel a little bit more settled. Sometimes just placing the hand on in those areas and relaxing those shoulders and just focusing on your breathing, a bit like we do when you're checking in on your breathing, can be a really helpful way to start settling the breathing. The next thing you can try and do is what we call rectangular breathing, where your out breath is longer than your in breath. So imagine a rectangle, or maybe you might be able to see a picture frame or a television screen or something in the room that you're in, and you can trace that in your mind's eye. But the short sides are your in breath and the long sides are the out breath. And the pace and the speed of that has to fit you. So what I do now, if that doesn't feel comfortable for you, that's absolutely fine. Find your own rhythm that works for you. But essentially, imagining that rectangle in your mind, you're going to breathe in on the short side and breathe out on the long side, so it's a little bit longer. Breathe in on the short side, breathe out on the long side. That might be a count of 2 or 3 seconds on the breath in, and 4 or 5 or 6 seconds on the breath out, but or it could certainly be longer. It really depends. And this isn't about taking a really deep breath, this is about having a settled breath, but thinking about the out breath being longer than the in breath. Give it a go, see if you find that helpful, and if you do, have a look at my website and look at some other ways that we might be able to work together, and I can maybe help you find control with your breathing again. Take care.